Okay. Okay. Hi, everyone. It's Susie. Tonight, we're just going to have, how should I say it? I'm going to have some very general overview of diabetes because for the past, I would say 30 years at least, myself, I need to know more because my mom was a diabetic and then my grandpa was a diabetic. So all I can tell you now, today, after 30 years, I know, I'm so glad that I'm committed to find out how to help these people because I know I will not become a diabetic. I will not. I told myself I make sure I won't because I know in general what caused it, and I just have to, discipline myself, have a good diet. That's it. Because what I have seen in my 30 years of working with people, I have to say, diabetes family people really suffer. If I can tell you, 50% of the people suffer cancer, it could be from this family. And children's, children problem, eczema, allergies, all these, maybe I would say these overactive kids. You know how many children suffer allergies, asthma, all these little, how should I say it? They have all kinds of problems. All 50% come from diabetes family history. Okay, so I was very interested, and thank God that 10 years already, I can say this is the simple, best product to improve everyone in the diabetes family tremendously. I can say that, tremendously, because I don't have my copy of the book that I carry for like 30 years. It said, you want to reverse diabetes? He said, you have to know what caused it. It is from fat. It's fat. Kind of like funny, right? It's sugar, right? Diabetes, you cannot eat sugar, no sweet. But the end result is that when your body cannot process all these sugar, glucose, they all turn into saturated fat. And that's where all the complication comes in. So in the years I've been working with people, I mean, I can just give you, there was at least 2 or 3 cases. I do my survey, okay? So I met this grandmother, and she's a diabetic, and she had the son, okay? And then she had a grandkid. And that grandkid is already 10 years old, still bedwetting, wet, urine middle of the night, even daytime in school. So the grandma said, oh, my grandkid love to play and don't go to the toilet, so always wet. You know what? I kept all these survey. Then I have another lady came to see me in Hong Kong. Same thing, her son 11 years old, do the same thing. And so what the doctor did to the kid is that prescribe medicine for him to take before he go to bed, that no urine will come out, no urine will come out. So in a way, it's a pill going to the kidney and just shut it off, no wetting the bed, So I asked the mother, I said, anybody in this child's family have diabetes? And she said, the father has diabetes, okay? So it's just so on. Then I met another family. Father is a taxi driver. And he was diagnosed at like late 40, having diabetes, right? So you figure that's 48 years old. That's a lot of people came down with diabetes too at old age. So he said, oh no, my mom and my dad got it at old age. So people don't think it would impact on their life. Trust me, I've done my survey for 30 years. you better count the years. So this family, the father was a taxi driver. He got diagnosed with diabetes at 48. I think it was 48. His older son is the healthiest son in the family. I think it was 21 years old. The second son, teenager, okay, he has mental illness. Then the third son is like only like 11 to 12 years old, suffering lupus. So here I'm sitting there working with this family. I go by years and I say, okay, this taxi driver is 48. So 21 years ago, he's only 20 some years old. So of course, you know, he was still healthy. So the older son was the healthiest son in the family. Then the second one, you know, probably starts setting in. It's just the father never go and check and never figure out what happened. So then the third son really got the big trauma, lupus. So honestly, I tell you what, I always share with my customers and ask them, if the customer tell me all kinds of problems they have, I always say, anybody in your family suffer diabetes? If they say yes, even uncle, auntie, brother, sister, okay? Same thing. Doesn't have to be the mother and father. I say, you're gonna be taking this product for a little longer time for the results. The other group of customers have no relationship, no connection with diabetes family history. They get result fast. That's the facts that I'm giving you. Okay, so I let you know what's going on. Well, diabetes is, most people just commonly know, just don't have enough insulin. You know, the carbo, the rice, the noodle they eat, the sweet they eat, the body cannot convert, so the blood sugar stays in the blood. So when you go take the test, oh, your glucose too high. That's the common knowledge, okay? And it's true, because their pancreas not functioning too well. Well, of course, there's a latest story is that diabetes actually caused from inflammation. The cells in the pancreas not too inflamed, heaty, okay? I have a relative, was like that, very healthy, but again, you know, is a family father at old age became diabetic, okay? And the son, very healthy, you know, travel, working, 50 years old, suffer pancreatitis. So inflammation. And once that inflammation subsided, he became diabetic. That's what it is. So watch out, okay? Nowadays, everything's inflammation, including cancer. So there are two types of diabetes. One is type 1, and usually, how should I say it? That means no cure. Doctors say that, you know, if you came down with diabetes before 14 years old, that's it. You're gonna be on insulin for the rest of your life. And I feel sorry. Okay? Not true. Okay? All I can tell you, there are more and more children coming down with it. I was at the convention and there was a man from Ireland. His girl was only 12 years old. Now, nobody in the family had diabetes, just this girl started it. Inflammation. Okay, she took a lot of antibiotics when she was a kid. She was only 12 years old. Now she is on insulin. So it could start with any individual. If they very careless in the diet and just all kinds of sweet stuff nowadays, you know, all the snacks, everything, and that's it. Inflammation will trigger it. And if the tissue happen to be in the pancreas, that's it. So type 2 is usually people that are, you know, older, you know, they start getting, well, the blood tests say, oh, you got too much sugar, glucose. So you have to take medicine. So that's common, right? And honestly, to me, both type we can try. We can try. And I must say, after 10 years sharing this product with everyone, especially people in the diabetes family, I have to tell you, this is the best product for myself, okay? Because I suffer hyperglycemia, very, very common. If I skip a meal, I'm shaking, I faint, I can literally faint, okay? So this product has balanced my, I would say balance my sugar, balance my blood sugar level throughout the day. I get more energy. So in fact, fat produce longer energy than sugar. You see, when people with diabetes, they really kind of, the blood sugar drop too low because they, if they take overdose of medicine, or if they, well, what it is that the sugar flip-flop too much, and it could happen to, it can come down with stroke too. Now, the problem, all the complication for diabetes is you can get a stroke, heart attack, go blind, kidney problem. Now, in Taiwan, I go Taiwan often. It's one of the highest number of dialysis, kidney dialysis people in the world. And 50% of those already have diabetes. And because the complication is the kidney. Okay, why? I will try to explain later. So sex impotence and numbness, these are all symptoms or complications for people been taking medicine every day. You can take it for 30 years. You end up blind, especially diabetes 1 type 1. These kids are putting insulin shots, and honestly, your blood flip-flop all the time, depending what you eat. And if you don't know how to manage it, it does cause blindness and can be very, very young age. It's really sad. Now, the good story is that I was in Canada and doing a meeting, and there was a lady so excited. She came up and shared, and she suffered 30 years. She takes pill, she takes the medicine for 30 years already. And the eye kept on bleeding, and she done laser treatment for 6 times on one eye. And that eye's vision already, only she can see 25%. So one eye, it can go blind because she keep bleeding, and laser, it just, create a lot of scar tissue in there. So 30 years. Her friends shared ring soul with her. She started taking 3-4 packs a day. Back then, we just had 1 ring soul, that's it. And she said she kept taking it after 3-4 months. She noticed her vision became clearer and clearer. She went to the optometrist and then went to the eye doctor. They all confirmed 75% good vision. Very happy. She's in the late 50s. She was in the late 50s, so she'll stay okay, pretty sure, because now she can see 75% instead of 25%. So I have I see many, so this is the reason why I said this product for my own use to balance my sugar is so important. And if you always feel tired, if you notice, if you come from a diabetes family history, always tired, going to urine so often, all of a sudden you lose weight, that's serious. Actually, if you lose weight, it's serious. and you have wounds that very hard to heal. You know, some of the complication is people have to amputate the legs. I seen a lady in San Francisco, 70 some years old, amputate her 2 legs because diabetes and also dialysis. It's horrible. It's one of the, to me, I think it's worse. I mean, there's some illnesses that, you know, you don't suffer, but diabetes family people suffer because they don't know, they're ignorant. They don't know, they eat the wrong food. Always hungry, why? They take the medicine create hunger for them because the medicine put in this insulin and they can digest all the food. But then the tissues are suffering. So they eat more than what they should be taking. Blur vision, okay, numbness, hand, feet, and yeah, always drink, always pee, and always all kinds of infection. So I tell you what, that was the reason why I had frequent bladder vaginous infection 40 years ago, because my mom was a diabetic, okay? So of course, you know, I pee a lot. I don't know, because every day I go toilet 2 times before I get on the driving, going to work for an hour. I have to look for toilet right away when I arrive at the building. So it is something that I thought was, that's just me. You know, I just have to get used to it. But now that I know, I warn people. I say, if you have a family history of diabetes and you already have little symptoms here and there, you better change your diet and you better take Rinso. No other way. Yes. Today in America is projected, estimated. Every 3 person, there could be 1 diabetic. That's scary. It's going to affect the brain. It's going to affect vision everywhere. Now, this is the key thing I want everybody to learn. Our blood should be pH 7.365. That's the really standard. Okay? Why I want to show you that? Because sugar is very acidic. Sugar is very acidic. Okay? So if you put some salt in your water, salt is very alkaline. Okay? I'm talking about blood. You know, there are other people outside promoting water alkaline. No, I'm not talking about that, please. This is not water, this is blood, okay? And there's no blood test would detect your pH on the blood because it changes. It changes. Yeah. In fact, if someone just talk about alkaline, it's a no-no. The government will penalize you. But I want to let you know, sugar is acidic. So automatic you're in the acidic group. Okay. Now, acidic diet, okay, is mainly sugar and bad fat. Okay, they're the same. Sugar, undigested glucose will turn into bad fat, saturated fat. So they're the same. So they're acidic diet. Okay. And moderate imbalance, if you keep doing that, because you see, your kidney has to monitor your blood. The kidney has to filter the blood. So the blood has to be perfect. If you are if you have that, if you eat a lot of sweet, or you have, how should I say it, you're from a diabetes family, you would tend to be on the acidic side. And the kidney notice it, okay? The kidney will help you eliminate it, will help you eliminate the excess glucose from the blood. So you pee, okay? When you pee, these so-called will be flushed out. So that's why if you flush out too often, you go to pee too often, watch out, okay? It will leach out calcium from the blood. Now, Also, diabetes complication, one of the is pain too. I mean, I've seen people, they said, don't touch me, I'm painful. They have a lot of nerve pain. That is really, really very serious. Because I told you, sugar is too much glucose in your blood. It's very acidic. That's why a lot of people have a lot of cavities. Even the sugars in the saliva. Even you brush your teeth all the time. So people from a diabetes family, please, if you eat some sweet, better drink a mouthful of water and go rinse your teeth. Okay? Otherwise, or drink a mouthful of water frequently, because even the saliva is sweet. Because my kid, I didn't know all these. I wish I knew all these before. I didn't know. I try to, eat good, but my son had a lot of cavity when he was young, same as me. Before I was 12 years old, I already got a lot of cavities. But thank God I changed my diet 30 years now. I have no cavities at all for 30 years. Okay, so nerve, very important. Yes, the liver responds to water very fast, sugar very fast. And if you cannot use it up, it will all saturate it will change into fat and fatty liver. Most of the people from diabetes family will come down with fatty liver. Now, very interesting. 2017, the Nobel Prize awarded in medicine was about sleeping. Did you know you sleep late? Your chance of becoming, let's say you have no family history of diabetes, but if you're constantly eating these, junk food, sugar drink, all kinds of, so-called create inflammation food, and you constantly sleep late, past midnight, you watch out. You can be a new case in the family. Like I told you, that little 12-year-old girl suffered diabetes. No family history, strictly because of diet, what people eat, and the lifestyle, sleeping late. Honestly, diabetes increase all types of cancer. I met a lot of ladies suffering breast cancer. The first thing I usually ask, anybody diabetes in your family? I would say 50%. They say yes. So just because it's sugar, it's acidic, excess sugar turn to saturated fat, and bad fat block oxygen. Lacking oxygen when you have a lot of bad fat. Your skin will show. Your skin will show. That's what the magazine said. Okay, they have names for this skin, two-tone skin right around the neck. This is a pre-diabetic condition. People can tell from your skin. So fatty liver is having all these excess glucose in there. Okay, now your brain definitely control. Okay, I'm not going through that today, and it controls it through the endocrine system, and pineal gland, and all the way down here, pancreas. Okay, yeah, it's controlled by the brain. Now, the liver. You see, the liver stores glycogen, which maintains stable blood sugar levels. In general, even a healthy people, any excess glucose, they don't use it up during the day, it will store in the liver. It's okay. Then if you skip a meal, okay, you make it. You're too busy at work, you skip lunch, you can work because sugar that's kept inside the liver, that glucose, can come out and sustain you, okay, until you have time to eat again, to get the calories. So the liver is very, very powerful. Now, this is what I'm really, I go real general. Like I told you, I'm just a layman, but what I learned to help myself, okay? So for those of people say, oh, I already have medicine, okay? Yeah, you on medication and you need it. You have to take the medication every day. That's what the doctors say. And you do have to follow. So never, never, please never ask anybody to stop medicine, please. Okay, the medicines are needed and they have to listen to the doctor. Okay, so I'm just giving you some knowledge. In the pancreas, there's a beta cell. Okay, there's a beta cell, the blue one. Okay, right here. The beta cell is the cells that produce insulin. So when we start eating something sweet, automatic through your sense, it will start working, pumping the beta cell, pump the insulin out. So if your insulin, if enough, you have enough insulin, all the sugar that you taken, okay, whether it's rice noodle, sweet drinks or fruits, doesn't matter. Your body will automatic, the insulin secrete and will break down the glucose and then bring it to your cells all over your body for energies. Okay, so that's normal. That's the normal process. Okay, all right. Now, beta cell, sometime our function, our balance. That's what it is, our balance. And when the doctor told me before, 40 years ago, that's exactly what he told me. You just have to balance. Okay, there's a K plus channel and there's a calcium Ca2 channel. Okay, you just have to know what they are there. So your cells, okay, this round thing represents your cell. Okay, now when you start eating the sweet for normal person, okay, normal person, okay, the K channel is called the potassium channel. It will open up. This is normal. When you're not, no, this is the cell that you're not eating yet. Okay, the insulin's in the beta cell. You're not eating yet. So the potassium channel's open and the calcium channel's closed. Everything's automatic in your body. I mean, I went to the site and this is what they teach us. The minute you start eating, okay, your cell knows the glucose will come into the cell. They know. So insulin, get ready to work. Okay, get ready. The beta cell. So guess what happened? When the glucose start coming in the cell, okay, the potassium channel will close. You see? When it's nothing eating, just potassium open, calcium close. When you start eating sweet, you taste it, everything, your body automatic in the cell will say, oh, now I close, potassium close, okay? And the calcium channel open and go in to the beta cell, say, hey, insulin, come out, come out. So the beta cell had to secrete these insulin into the bloodstream so that all these glucose will be properly utilized. So if there's people don't have enough insulin, if they don't have enough insulin, if the beta cell cannot produce enough insulin, then the blood, all this glucose will stay inside the blood. And that's when you go take a blood test, oh, your sugar's high. Doctor say you have diabetes. Yes, this is it. Automatic, okay? So you gotta make sure your pancreas, your beta cell is so strong and healthy, always, ready to work. Come on, nowadays you see people, they constantly drinking sweet stuff, they constantly eating sweet. I'm telling you, this gate will keep busy, right? Okay, they're busy. So that's it. So when you don't have glucose, you're not eating, insulin's resting. See, no need to produce because the potassium channel open, the calcium channel quiet down, shut. So no signal to tell the beta cell to work. Okay. Now, a lot of people, how should I say it? This is the interesting part. Now, I want you to see, this is a cell lining, membrane. It's lined 55% cholesterol. How sensitive this, what they call the receptors, the potassium gate and the calcium gate, how it all depends how flexible is your membrane. Because this is a cell. All the receptors are there. Now, this is an interesting one. This chart explains when these people suffer diabetes, they have to take medicine. Okay, this is not the insulin injection, but it works the same. But this is like drug. They take a pill. They have some medicine. The doctor gives you some medicine to take. All right, so you can enjoy eating your dessert and whatnot. Okay, now the medicine forcefully close the potassium gate. Forcefully, it's supposed to be closed, and then open the calcium to signal the insulin come out. Well, in this case, because the medicines are really good nowadays, so advanced, you take one pill. Then people just need to take one pill. It depending how high the glucose, the doctor will know. So when you take this medicine, it does work. I told you, I've seen people taking medicine for 30 years. They still very good, healthy. And this medicine will artificially block this potassium channel. And then when this is closed, the calcium channel automatic open up. And then it will come in, say, knock the beta cell. Beta cell, I need insulin come out. Let's stop here. Let's think. You understand why these people take medicine for the last 30 years and they end up having a lot of complications? That they amputate the leg, they're going to have mental illness, and they're going to go blind? Why? This medicine is artificial, force that receptor to close, to open. And then this poor beta cell are being pushed to keep producing insulin. This beta cell wasn't that healthy to begin with. That's why it was out of balance. Now with the wonderful drugs, with the wonderful medicines that, can alleviate the problem and allow the person to have a regular 3-meal diet. Right now, that's the only way the doctor can treat the patient, is to have some sort of just like antibiotic. It's just something, medicine to help you go on normal for a while, but you end up collapsing. The long-term solution is that eat some wholesome food, nutritional food to feed your beta cell. You understand? Eat some good food to clean up the membrane that has bad oils that are doing the blockage, that the receptors can move automatic. The cells can function properly. That's the ultimate solution. Taking this diabetes pill or taking insulin is supposed to be only temporary. Please, this is my philosophy, okay? Because I work with enough people. At the end, they cut off the leg, they go blind. It's not worth it, okay? So that's why I'm overjoyed. For 10 years already, I have seen this product so powerful because it changed good oil in, bad oil out, and then the receptors can function properly. That's why a lot of people, after they take it for a while, they go back to the doctor checkup. The doctor say, oh, your sugar improved a lot. Let me lower the dosage of the medicine. There's some people take two insulin shots. They drop the doctor reduce the units for them. Yeah, that's proper. Well, in other words, is that you want to feed your cells. You want a long-term result. Okay, medicines are good. It's for emergency, for a quick fix. But if you understand this, forcing the beta cell to produce the insulin, and here instead the doctor should tell you, come on, cut off the rice, cut off the bread, cut off your Coca-Cola. You understand? For long-term approach, we have to change our diet. Yeah, there are clinics out there that can reverse diabetes automatic if you follow the diet. A lot of good vegetables. You can eat meat. The good diet is make sure you have good protein, good fiber, and good fat. Okay, you can have a little bit. Eat your sugar. Save the sugar sweet for fruits. Okay. But don't eat too many fruit. 2 a day is the most. So my experience is that most of the diabetes people in the family, they suffer digestion problem. They suffer constipation so bad. Now I'm speaking for myself, okay? And I survey many people. So these kind of food, I tell you what, I probably already, maybe only 10% I eat. Lifestyle, nutrition, family history, heredity. Yeah, they say heredity only 5% problem, but for diabetes family, I think it's 50% of the problem. Other types of illness, not so bad, but only diabetes. So you want your grandson to become healthy, no eczema, no allergy, you better start feeding those grandkids a soul a day. Okay, the good oil give them energy instead of, they run around, they need energy. So you feed them sugar sweet, it could drive them crazy. But this is fat, cold pressed seed nutrition, essential fatty acid. It gives the children a long lasting energy. So this is my little chart. Grandparents have diabetes. Okay, sometimes skip one generation, but then it will hit the grandkids. Okay, I seen them. And then parents hand down to children only one, how should I say it? 1-to-1 chance. Okay, it's like 1-1. Okay, but parents don't have any diabetes, but your brother, sister suffer diabetes. I tell you what, it's 2 times you could get, you might become a diabetic. I've seen too many family. Older sister got it, younger brother got it. I told that's my friend. That friend is still the one okay. I said, you better watch out. You better start taking this product. Because if your brother, your sister had it, you have a 2 times the chance to become diabetes. Okay, so don't be ignorant. I've done my 30 years of survey. Okay, you can start doing your own survey. Now, diabetes management is don't let the glucose in your blood go like this, and then starve yourself, the sugar drop. Yo-yo, we call that yo-yo, you know what I'm saying? You eat a lot, and a lot of sugar, then your beta cell has to work very hard, has to produce a lot of insulin. Then you skip meal, and then you're too low, you can get a stroke. You want to reverse diabetes, you keep it, not too peak. So maybe frequent meals, okay, select your meals, and food combinations important. So instead of trying to teach you how to do that, I tell you what, this is the easiest thing. Easiest thing. Yes, rain sauce, powerful. And it's cold pressed black cumin seed. This is the power. And it's all the phytochemicals, so important, along with the essential fatty acid, omega-3 and 6. It does work. I have seen some people, if they're not very bad, they actually gone back to the doctor, and the doctor was amazed, and the doctors actually lowered the medications for them. Okay, but we should never tell them to stop, okay, please. They have to listen to the doctors, okay? Because it takes time to recover. You have to allow your pancreas cells to regenerate. Now, why, there are a lot of people ask me, oh, this thing is so sweet. I have diabetes. How can I take it? I said, don't worry. This product is so powerful. It has the ribose in it. I think it's the power of the black cumin seed and the ribose. The ribose is extract from non-GMO corn. Okay, it's called a 5-carbon sugar, but really we should cross out the word sugar. Okay, and no sweet. The 6-carbon sugar is sweet. This one only has 5 carbon. So the ribose is the energy, how should I say, the ATP, energies to the cells. Now, it has lots of good science study, but this is the one that I love. Lower blood sugar levels. The studies were done back 1988. So it's a long-term study, and it caused decline in blood sugar. See how beautiful it is? D-ribose lowers the blood sugar. Why? It gives this is the energy. It goes in, and when your cells are working, you energize, you're more active, you burn off glucose. So, okay, then another thing, the black cumin seed. So that was the ribose, it's in here. And this black cumin seed had a patent for diabetes. So you got 2 ingredients here that are lowering the sugar. So I usually explain to my customers like that. We added cane juice to flavor. If we don't add the cane juice in there to make it taste good, you take the black cumin seed and the ribose, you probably drop your blood sugar so fast that you pass out. Okay, so just go enjoy the taste. This cane juice is good for you, got a lot of mineral. And knowing that the black cumin seed and the ribose lowers the blood sugar. So we have people taking this, and yeah, it's feeding the whole thing. This is nutrition, whole food. It starts feeding your brain cell, your bone cell, everything, okay? And it will feed your beta cell. So when the beta cell got good flexibility and the receptors are flexible, automatic, the gates are open, automatic. And the produce insulin, automatic. So this is how you recover by yourself, okay? So don't get mixed up. This is not medicine, please, huh? So anybody suffering diabetes, continue your medicine. You take this as a nutritional food, and then after so long, 3 months, your regular time, you go back to see your doctor will instruct you what to do, okay? So we have studies on it. Type 2 diabetes works very well. So in conclusion, I tell people, I said, Yes, this is a wonderful product to clean out the bad fat. And diabetic people suffer because of fat. Glucose turns to saturated fat. So if you can get those bad fat out, you will recover. Your beta cell will start functioning. So this is it. Good oil in, bad oil out. Thank God for the ring soul. And then for people that have been, taking a lot of medicines for a long time, and the liver is probably, overloaded with fat, taking the core is wonderful together. Okay, wonderful. Okay, so this is it. Okay, so it's kind of like overview. So I hope everyone understands a bit more, and just feel free. Tell you what, everybody needs to take it. Okay, thank you.